How are you?
Good afternoon, and welcome to the Groveland Council on Aging. We have a program this afternoon for you on home care, what you should know. And that's going to be presented by Joanne Tebow from the Elderinsider.
Thanks, Lynn. Thank you. Nice to be back here to Groveland. This is probably maybe half a dozen times that I've been here, and I see some familiar faces, so thank you for inviting me back, Lynn. My name's Joanne Tebow. I'll tell you a little bit about the Elderinsider and a little bit about my background before we begin. I've been in the healthcare industry for 25 years. I'm originally from Gloucester. All of my career work has been right here in Massachusetts on the North Shore, Merrimack Valley, and Greater Boston area. A couple of years ago, I started the Elderinsider for the sole purpose of coming out and doing educational seminars for the 55 plus population, the consumers, to learn more about options and resources available to us. It's all about education. My website is theelderinsider.com. I don't sell any services, but I have over 100 informational articles that hopefully helps answer some of the questions, the everyday questions that we have about different areas. Because nowadays there is information overload. When you go onto Google, it's overwhelming. Even for people that are in the healthcare industry, it's overwhelming to navigate. If you enter, say, for example, home care, Massachusetts, probably 1.6 million hits you'll get, or results they call. It's just crazy. So that's why I come out and do what I do. And home care is one of the many subjects that I cover. And this is really an important subject. It's a hot topic. And we're going to go over 3 different areas of home care and how they differentiate from each other and what they're all about. We're going to talk about home health services, which is otherwise known as VNA, or Visiting Nursing Association. We're going to talk about that, what that is all about, how that differentiates from state-funded home care services, otherwise known as elder services, such as Elder Services of the Merrimack Valley. We'll talk about that. That's funded in part by the Executive Office of Elder Affairs. And then we're going to talk about private pay home care services and the differences about private pay and what's that all about and what you can expect from that. Okay? With the growing population, 10,000 baby boomers are turning 65 every day and have been since last year, since 2012. The senior service industry has quadrupled. It's booming. Everybody is opening up a senior service industry, an agency of some sort. So it's more important now, more than ever, that we understand the differences between these agencies, know what questions to ask when we're shopping for them, because we all have choices as the consumer, and they all want you to pick them. And so we need to be aware of what to expect, what the credentials should be, what questions to ask, and expectations. So let's talk about the state-funded home care, otherwise known as Aging Service Accent Points. It's an ASAP. These are just some different terms that you'll hear and also maybe see online. So there's the ASAPs, that's still Elder Services. For example, Elder Services of the Merrimack Valley is the one in your area. Also known as Areas of Aging is another word for them, and they're all funded through the Executive Office of Elder Affairs. There are many, many, many programs available through Elder Services. Too many for me to talk about today. One of the handouts that you either have now or that you can pick up after lists some of them. It's called Healthcare Options, Executive Office EOEA. And I have a couple of them listed here, one including Shine, which is also available. Does anyone know familiar with Shine? Shine, it's Medicaid, it's help with, it's volunteers that are trained by the Executive Office of Elder Affairs that come usually through Council on Aging or senior centers that are available to provide you with questions about your health insurance and Medicare. Valuable, valuable, valuable. A lot of people don't know about them and that they're here to access free of charge. And there's several other programs. Specifically, let's talk about the home care part. They do provide personal care, homemaking, transportation. Other services include legal services, money management, and many more. I listed the phone number there for you too, if you have it. And of course, Lynn and Nisha have the information for Merrimack Valley Services. If you don't have that phone number down, they most certainly have it here. A lot of these are on the handout, so you don't have to write them all down. But this is just an example of some of the services that are available through Elder Services. Caregiver support, care planning and advice, health benefits, which is the Shine, home care services, money management, nutrition services, protective services. Let's talk about eligibility. Okay, so eligibility for Elder Services is income-based. Not everybody is eligible, and unfortunately, many of seniors fall right in between that crack where they are just over the limit for eligibility, but really don't have a whole lot of funds for private pay. It's unfortunate. The best suggestion I can give to you is to call your Elder Services. This is a guideline. The numbers I have up here are the last time I checked. With government and state, you never know when they're going to change guidelines. They're very easy to talk to, the referral services. So and regardless of whether you think that you may be eligible or not eligible for these programs, call anyway, because some of the programs do not have an income eligibility limit on them. Some of them are free to everybody, no matter how much money you have, okay? So whenever I am talking to anybody about starting the process of in-home care services, I call your local Elder Services. If you live in Danvers, it's Elder Services it's North Shore Elder Services. If you live in Gloucester, it's Senior Care. There's 35 of them in the state. So always start there. If you are eligible, you really, does anybody have, at first I should ask, does anyone have any experience with the Elder Services?
Yes, with
Okay.
my sister. On the income level, annual income, what does that include?
That includes.
I mean, I know Social Security and everything, but what else is taken into consideration for annual income?
That's it.
What
Dividends,
about
what
your-
your annual income is.
What
Not
about-
all your assets, not your house, because that's not an income. It's not your assets, it's your income.
What about your retirement funds?
If you're getting that as an income, yes.
So that is
Dividend,
part of
yes.
it then?
Mhm.
That was the big thing I wanted to know.
Yes.
Is it included in your annual?
Yes.
So
Yes.
that could put a lot of people out of the ball.
It could.
Because Social Security is not gonna bring you up.
No.
So
No.
that's a big thing to know.
Yes. It's what you're living on a regular basis. If you have $3,000 a month coming in, then you have $3,000 a month coming in.
But your retirement fund may not be touched till maybe 6 months up the road, but is it included at the end of the year?
It is included, I do believe, yes.
You may not get that every
Yes.
month. You may not
Yes.
get a pension, but you may dig into your retirement.
Yeah, it's available funds. Yeah,
So that makes a big difference.
it does, yes.
Is it a specific line number off your income tax return that they're looking for?
That I don't have the answer to.
Okay.
Yeah, that would be a question to call, to ask them, or go talk to your CPA about that, or accountant, okay? So this is a start, because again, I just want to emphasize there's so many programs, and let's see if I have a website on here. Okay, I'm going to give you a website that's very, very easy to access, the Executive Office of Elder Affairs, and it will list all of the programs available. It's 800-800-info.com. Just gonna
All lowercase?
double check my memory here.
And that was the executive office?
I'm sorry, this is why I gotta check. Okay, it's 800-800-AGE, A-G-E, info.com, and that's the Executive Office of Elder Affairs. It's a great website. It's so easy to navigate. And you just pick your city, wherever you live, and it'll bring up the ASAP, the Aging Service Accent Point, or tell you the Elder Services. And it also, there's on the menu there, and it says Programs and Services. You click on it, and it'll list them all.
Is that federal? Is that a federal site?
State.
We're back to this issue about snowbirds.
Oh, sorry. Yeah,
Thanks.
I know. But you know what?
That's
They
all
would
I-
be able to answer questions like this. My job is to give as much information as I can, but
Yeah.
I'm not an expert on all of that,
Sure.
unfortunately. But so anyway, great website to learn more about the programs that are available. So that's number one, okay?
And that's the executive office?
Executive Office of Elder Affairs. Yeah, and I have that on this handout as well, is the listing of it, if you didn't grab one. Okay, all right, so let's talk about home health services, otherwise known as VNA services. Has anybody here in the audience had needed VNA services? Okay, we got 4, okay. What was your experience? Any comments about the experience? Good, bad?
I just want to make people aware of the fact that if they're not happy with the service, that they can request that person not come in again, and they will send somebody else.
Absolutely, and I have that up
So-
here, and that is a very important point to make.
Right.
Also, to remember the name of your home health agency. A lot of people just refer to it as the VNA. The VNA was it.
Huge.
Well, which VNA? I don't remember, but I loved them, but I don't remember which VNA it was. It's the VNA. They're all different, and there's for-profits and non-profits, and within continuum of care owned by healthcare organizations. Stewart has their own VNAs. Partners has their own VNA. There's so many of them. So it's important, number one, to remember, if you have had in the past a VNA, what the name of the VNA is. So if you liked them, and if you ever need VNA services again, that you request them. Or if you did not like them, that you remember that you don't want them. Because when you go into, when you're being discharged from a hospital or a rehab, and normally VNA services, most commonly, you're eligible coming out of a rehab. If you're not going to make a choice, if you don't know which VNA to ask for, they're just going to give you theirs, because they want to keep it within their own continuum of care. Keep the money in the circle, as they say. Or whoever their best friend's buddy is, to be honest. Okay? So I'll talk to you a little bit about the differences of VNAs, and also about what you had mentioned too. So a lot of expectations and what we should expect from VNAs, and people don't know this, and that's why they are all different, and they all have different programs as well. Okay, so it's a Medicare benefit as well as private insurance, some private insurances. Most 95% of the time or higher, it's Medicare benefit, okay? Your eligibility comes from, but not limited to, the discharge from a hospital or rehab. And I say not limited to because It is, your primary care physician is the one that orders it, okay? Now, if you're home already, and I get this question a lot, if you're already home, if you know somebody that's home and need some assistance, call, ask for, have their doctor give them a referral to a VNA and have the VNA come in and do an assessment to see if you're eligible for VNA services. There is certain eligibility needs, and I'll go through that, but you can be at home and request to have VNA come in. Okay, it doesn't have to be, did you do that? Yeah, and it doesn't have to, so it doesn't have to be directly from a discharge. The amount of care you receive is determined by your diagnosis and the evaluation. It's conducted by the home health care agency. It is under Medicare guidelines, so there is eligibility. One of them being that, well, that's on the next slide, so let me finish the slide. Okay, so the services included are the nursing and rehab services, skilled nursing, PT, OT, speech, social services, and home health aides. For eligibility, you need to have a skilled need. You can't just need the custodial help with ADL bathing. So if you only need a home health aide, you're not going to be eligible for VNA. And VNA is short term. So to qualify, you must be under the care of a doctor. If you don't have a care of the doctor, if you don't have a primary care physician, and this happens to some people, they just don't for whatever reason, you have to be appointed a PCP before you can even go into have this benefit. You must be considered homebound. A lot of confusion with this too. If you're able to get out, go to lunch, get your hair done, drive around, I'm sorry, but you're not gonna qualify. Or while you're having VNA services, home health services, and everything's going great, and maybe you're on the rebound quicker than you thought, and you're going out to lunch, they're going to come in and go, it's time to discharge you. That's their term, even though you're not in a hospital or a facility. They call it discharging you. They're going to discharge you from services. And you're like, what? I still need. And they go, you're not supposed to be out and about. Okay? And you have to require one or more of the following. You have to require skilled nursing care, which is from an RN or an LPN, like wound care, IV therapy, something skilled that only a nurse can do, or physical therapy, speech therapy, or occupational therapy. Okay, you have to have one or more of those needs in order to continue with VNA. Home health aides does not count.
I think we were told you had to have the nursing. You couldn't have just the therapies.
Nope, you can.
Oh,
Say, for
okay.
example, I'll give you an example. Knee surgery, a total, or a hip, or a knee. Typically, the VNA, a physical therapy can come and open that case up instead of the nurse because it's specific rehab case. They can even, physical therapists can even do certain, like, change of dressing. Very minimal invasiveness, but for total knees and total hips, they're able to just do therapy. Yeah?
This information.
The other
Question?
thing that people should be made aware of, I think, is that, especially with physical therapy,
Yeah?
if they discharge you and say that you can go to facility to have,
Outpatient?
to have it done, it's not gonna be covered by Medicare.
Oh, correct. Yeah.
Well, yeah, that
You
can,
need to-
because I know somebody that did that,
Yeah.
because they felt capable enough to drive, and then they ended up owing thousands of
Yeah,
dollars.
you need to always check with your insurance company to find out what is covered and what isn't, and any supplemental insurance company that have with the Medicare services. I'm constantly calling not constantly, but especially when I go through my yearly physical and things like that, I learned a few years back, because I got stuck with a bill, but now I call my insurance carrier about everything. Just want to make sure. They ordered blood work, is it covered?
Yeah.
I have to go back in, they asked me to go back in for this test, is that covered? I just am, kind of neurotic about it. Okay, So how long do services last? It's temporary. So we're talking about home health care services, otherwise known as VNA services. It's temporary. Back in the day, when I was younger, when my mother was a registered nurse, she's retired now. She was a hospital nurse, but you know, she worked with the VNAs. So you had your community VNA, and people would have them forever. They'd come, the VNA would be, you know, Mrs. Smith down the street had VNA for years. Well, that's long gone with the regulations that have changed. So the benefit can run a maximum of 60 days. That's considered your certification period. But the home health agency can release you from care prior to that 60 days. That's called a discharge. And it all depends on your status, on how well you are doing with your healing process. It has to, in order for them to continue beyond a certain amount, say even 3 weeks or 4 weeks or for the entire 60, you have to still have that need. If after 3 weeks, if you don't have the skilled need any longer, you're fine, you've recovered, and you don't have the physical therapy or OT, then they have to discharge you. They are required to alert you and your doctor of their intent to discharge, to discontinue services, or if they decide to just decrease services. So just keep in mind, you're having VNA in there and you're starting with 5 skilled nursing visits a week. You're like, okay, the nurse is coming almost every day and I have PT in there 3 times a week. And the next thing you know, the nurse isn't showing up. What's going on? Well, I'm not coming 5 days any longer, I'm coming 3 days. And then next week, I'm coming 2 days. And then the week after that, I'm coming 1 day. Well, that plan of care, first of all, should be told to you, explained to you way at the beginning. This is how it's going to be. Week 1, it's going to be 5 visits. Week 2, it's going to be 4. Week 3, it's going to be 3. Week 2. And also that plan of care goes immediately over to your doctor. So it shouldn't be any surprise to you. If it is a surprise to you, they're not doing their job. Okay? And I've heard more than not that they're like, all of a sudden they stopped coming and I had no idea. Okay? So that's a lack of communication on their end. So again, there's no minimum service time guarantee. It all depends on the evaluation. If you keep services for the 60 days, another evaluation would be done, and that's called a recertification. You can be recertified into another period. Okay, now, you have the right to challenge a discharge or reduction in services. And also, the home health agency has required to give you a 2-day minimum. It's not very much. It should be, I think, more than 2 days. But the requirement is a 2-day notice of discontinuation of services, and the documentation to say so. So, in other words, they can't just come in one day and say, okay, today's my last visit. So nice to be, and you're like, what? You were never received that information, you feel vulnerable, you feel maybe that you still need some visits, and okay, so you call your doctor and you can dispute this and say, just get on the phone, okay?
Does this cover home health aid also?
The home health aid is not considered an eligible, no.
Okay, so this doesn't apply to that service.
It's the skilled. The same communication does. If you're getting skilled nursing, PT, OT, and a home health aid, as far as discontinuing the home health aid, yes, they should let you know. But if all you need is home health aid and you're not eligible for the skilled, you can't dispute that. They're not going to continue it. You have to need both. Okay? Basically what I'm saying is don't let them just, surprise you and drop the ball, and it happens way too often. So this is something for you to think about. Okay, so also now when choosing a home health aid, a home health agency, you have a choice. And also, I want to point out that if you're in the middle of a certification period, you're 1 week in or 2 weeks in, and you're just having a heck of a time with this VNA, and people are, for whatever reason, they're not showing up on time, different people are coming, they're not answering, you're just not happy. You have the right, as this woman had pointed out, to ask that somebody else come, but more than that, you have the right to change companies altogether. And in order to change the company, say you get on the phone with the case manager, the clinical manager, and say, not happy with the physical therapist you're sending me, they're only here for 10 minutes, I'm sorry, we're gonna send you another physical therapist. Another physical therapist comes in, maybe the same thing happens. And you're just not happy with them. You call your doctor and you say, refer me and transfer me, I want another VNA, and they can absolutely do that right smack in the middle of your certification. It's not a problem. A lot of people don't know that. I had one couple that said, oh my gosh, we dealt with this VNA it was a nightmare for them for 2 months, and they had no idea that they could switch to another VNA during that time. So something to keep in mind. Okay, so having a choice, and I talked a little bit about this before. So remember, think about the VNAs that are in your area, know about them. Probably the most popular one maybe is
Merrimack Valley. VNA of Merrimack Valley.
VNA of Merrimack Valley or Home Health VNA. Whittier VNA. Whittier has a VNA, that's right, out of Haverhill. Right?
Very good.
Right, you heard good things about them? Okay, you've used them? Perfect, remember that. So, because when you go into, say for example, and I'm not singling any organization out, but I'm gonna use Holy Family, for example. They're a steward organization. When you're being discharged, if you're being discharged from an organization, they may say, geez, well, let me sign you up for VNA, say it's you, and we're gonna send you home with our VNA, and you go, well, I want Whittier. And they go, oh, okay, you can have Whittier, but unless you say something, then they're gonna send you home with whoever, okay? So say you don't know. This is what I would do. I would ask the social worker or the discharge planner for 3 brochures in different companies. Ask to meet them. The liaisons for the VNAs are usually all over the place. They're in and out, the case managers. Ask to meet, can I come in? Ask about the programs, especially if you have certain diagnosis, stroke, Parkinson's disease, dementia, diabetes. What do these VNAs have specifically for me? What kind of programs do they have for me? Because they're not all created equal, and that's very important. And interview the home health, the home care agency as well. And another example of I had my uncle was going home. He's in the South Shore. My uncle went home after a long bout in the hospital and then a skilled nursing facility, and they were going home with a VNA, and I'm on the phone with my cousin, and I said, what VNA? And she, said, I have no idea. And a lot of people don't know. She goes, it's the VNA, and my cousin's very intelligent, and I said, find out what the name of the VNA is, and find out if they're going to be at the discharge plan meeting before discharge. So she called me back. She said, I found out what I think it was Norwood VNA of Norwood. And she said, they're not planning on being at the discharge plan. We have the discharge meeting is Wednesday, and Dad's going home on Friday. And he's very, very sick. My uncle is very, very complicated case. And I said, get back on the phone and tell the discharge planner that you want that VNA, a representative, a case manager, to join you at the discharge meeting, so everybody's on the same page. Because once my uncle went home, which they sent him home on, I think it was a Friday or Saturday, the VNA is the one that's going to be picking up all the pieces, and so it's crucial for them to be involved. Okay, so the third, home care services. So you are not eligible for elder services, say, okay, and you don't have a skilled need, so you're not eligible for home health services, otherwise known as VNA services. Then there's private pay, otherwise known as custodial. Some people call it non-medical. I don't particularly like that term, non-medical, because it is taking, you're looking,
Yeah.
have you ever heard that?
No,
That
but I
term?
find it very offensive.
It's very
Why-
offensive. That is it's a term that has popped up about maybe 10 years or less ago. And I started hearing it when the franchises started coming out. And I'll tell you why. There's a reason behind this whole coined phrase of non-medical. It's because Massachusetts does not regulate private pay home care.
Oh.
Okay? And if they coin it non-medical, which is non-skilled, as you don't need a nurse because it's custodial, then they don't even have to employ a nurse. They don't even have to hire a nurse, to have one on staff at all. I'll go into that in a little bit more detail. But so private pay services include certified home health aides, either hourly or live-in. It can include nursing services. There are agencies out there, and I happen to have worked for one back on Cape Ann that provided registered nurses round the clock, and we had several clients. Yes, it's very expensive. It's very expensive, but these clients had the means. Payment is either from long-term care insurance, which they do cover $200 a day, up to $200 a day, long-term care insurance. And also maybe some private insurances, if you have a rider in about home care. Haven't seen that very often, but I would call. And of course, directly out of your pocket.
Is long-term care insurance only for in-home?
No, you can use it for assisted living facilities as well.
Someone just told me, I just visited somebody, she said her insurance that they had been paying all those years did not cover assisted.
Oh, really?
She's up at Havel Crossing.
Oh, well, maybe that's her policy. I just came from an in-service. Happened to be at BG Bank Gloucester Financial Group the other day, and it was specifically on long-term care insurance policies.
Really?
And yes, they do cover in-house
She
facilities.
said her and her husband paid for so many years, and she said it
And they
doesn't
had
cover.
long-term care?
Yeah, they had long-term, and she said it didn't cover assisted living.
Could have been their particular policy, but I mean,
wondered if
that's
it
what it's
just
all
meant
about now.
in-home.
Between the age of 50 and 70, long-term care insurance is very big now. It's very, because it will protect you a huge chunk of your money.
And for in-home?
Yes.
It'll cover it?
It will, yeah. As long as that the agency that you use, you have to use a reputable agency. You can't use your hairdresser's sister's cousin, dog walker. And you don't want to do that.
Do you have a paper on that, any chance?
I do. Yeah? That's right up here. Okay, so Massachusetts does not regulate. So all kinds of people have popped up over the past decade, hanging up a shingle, getting on the money wagon train, opening up home care services, private pay home care services, non-medical, providing caregivers, and they're not even specifying that they're certified home health aides. So that's kind of scary, wouldn't you say? It's kind of scary. The way I look at it is, if an attendant, a paraprofessional such as a home health aide or a nursing assistant, when you are in a hospital, when you are under the care of a VNA, when you are under the care of, if you're in a nursing home or a rehab, and if you're under the care of, I said VNA already, hospice care, all of those paraprofessionals are supervised by registered nurses, correct? They're all supervised. Those medical assistants / CNAs, they're all supervised. You're in the nursing home, they're supervised. You're in the hospital, they're supervised. Same thing should be the case with private pay home care. They're supervised. They have to be supervised by a registered nurse when they work for the VNA. because that's a Medicare guideline, because VNAs are regulated. Okay? Same scenario. Unfortunately, that's not the case in Massachusetts, but it doesn't mean you can't ask for that when choosing a VNA. I mean, choosing a private pay home care agency. There's a lot of them out there that do provide supervision by nursing. Okay, I'll go over that with you. Yeah.
I recently heard of somebody that's getting paid to stay home with her mom, to take care of her mom.
Yes.
Is that,
That's in, that is on this handout under healthcare options, and this is one of the programs through Executive Office of Elder Affairs.
and the family
Yes,
member
there's
gets
different,
paid?
there's stipulations, of course, but you can go and check that out and look at the different qualifications for
'Cause
that.
she gave up like her job too,
Yeah.
and she was
Some,
getting paid.
it's for the stipulations, there's guidelines, yeah. Okay, so questions to ask, and I have a handout over here you can take home with you. Does the home care agency employ its workers? You want them to be an employee. You want the home care agency to take out taxes. Maybe matching taxes benefits, okay? You want them supervised. How long have they been in business? Can they provide references? Okay, they should be able to provide references. If somebody says to you, oh, we can't because of HIPAA, just hang up the phone. Does the home care agency verify employment backgrounds, criminal background checks, immigration checks, and are the caregivers supervised by registered nurses? That's just a few of the questions, okay? It's very important. How much does it cost? The average rate of a private pay home care, I would say in this area, is approximately $23 an hour. 23-ish, okay? Could go up to 23, 25. Now, with that, you get, if you choose the right agency, you get a 24-hour service. This agency is available to you 24/7. You have a registered nurse on call if you need to be contacted. If somebody doesn't show up, they automatically fill in. These employees are certified through the state. They're skilled. They're bonded. They're licensed. They're covered by workers' comp. You have no worries, okay? Because these are all the bells and whistles that are attached to that $23 an hour.
Do they have to have a driver's license? There was a
Most
case
of
where
them
one didn't have
do. Most of them do. And if you're in the city, and some of them they say I don't have a driver's license, and they have to take public
it.
transportation.
Yeah, they ran into that.
They those caregivers probably would work for more like a VNA or it's hard for private pay. Private pay, you need to. I've always required my employees to have driver's license
In a
when
car.
I worked. In a car, yes, in a car. It's very difficult to, even if they were the greatest and had the greatest references.
Because we ran into that.
But if they just don't, it's very difficult. So, these are the ranges, but that's what your dollars are paying for. And so if you hire your hairdresser's cousin's dog walker because she was wonderful with her parents and her grandparents and she does this kind of thing, okay, under the table as they say, you may be paying her $18 an hour or $20 an hour. And you're like, hey, I'm saving $3 to $5 an hour. But what you're missing out on is the protection, the supervision of a nurse, and the protection of any theft, liability, and all of that. And also home care services, private pay home care services, if approved by your physician, and most primary care physicians will write a medical necessity letter. You can write off your taxes. You can write it off your taxes. You need a medical necessity letter from your primary care physician. And I work with great companies, and one of the owners of one of the companies that I work with, she's a registered nurse, and she said, she goes, in all the years she's been doing this, she couldn't remember a doctor ever saying no to writing that letter.
And what's the letter called?
Medical necessity, letter of medical necessity.
When you say they supervise by the registered nurses, say for instance, a certified home health aide, does that mean they meet with the nurse on a weekly or monthly basis or something?
Yes, yes.
What's the communication
What that
there?
means
They don't
is-
come to you, the nurses don't come to you.
Well, yes, they do. What that means is the agency that you want to choose, whether you need a nurse or not. Some people are like, I don't need a nurse. I just need somebody to help me get in and out of the shower. I don't need a registered nurse. That's fine. But the agency that you get, the correct protocol is you call them, you say, I need somebody twice a week to come and do my shower, maybe run some errands for me and help me with this personal care.
Is that called a home health aide?
Home health aide, right. Okay, so the agency will say, great, we're gonna send out one of our case managers out to you, one of the nurses. It's an automatic. The nurse is gonna come visit you. She's a representative of the company. She's gonna introduce herself to you. She's gonna develop a plan of care. Even if the plan of care is just custodial and very basic, she's still gonna be the one to do it, okay?
Would she be your social worker?
So,
Would she be
most of
called
the time they're nurses, registered nurses. Yeah, some of them are social workers, but most of them are nurses, and then some agencies don't have that at all. The person that will come out and visit you is the owner, and they may have no background in healthcare whatsoever. Trust me, I know. Trust me, I know. They'll come out and they'll just say, well, it's a basic assessment. So you can and it's a checkoff sheet. Okay, so a reputable agency, they're gonna come visit you, and so the nurse will develop a plan of care, whether it's complicated or whether it's very minimal. They're gonna bring that back, they're gonna talk to the scheduling department, they're gonna make sure that they assign the correct home health aide for your case, depending on your needs, your personality, where you live, the hours that you're looking for. There's kind of a lot to go into it. She's going to then talk to that home health aide prior to going into you. She's going to talk one-on-one, give them a copy of the care plan and say, this is what Mrs. Smith is expecting, this is what we want you to do, this is what her needs are. Most of the time, they'll also go and do the first introduction and say, hi, I'm just introducing you to your home health aide. Okay, if they're able to do that, they do that, the reputable ones. Sometimes if it's last minute, they might not be able to. But they always do follow-up calls, and they'll always come and check on you, and then they'll always go back to the home health aide and make sure that they're doing their job.
Will she be the same person? And if she isn't, how do you get a social worker that you always can rely on to contact?
A case manager, we're going to call him case
Case man-
manager.
alright.
Case manager should be assigned to you, to every single client.
So it
Everybody
would be
has a
that
case
same
manager.
person every
Yeah.
time you needed to contact?
Everybody, yeah, the same person.
And she
yeah.
would be the one
So if
that
you
started
have-
the whole ball rolling?
Yeah, exactly. And so if you had any questions, say you're not happy with your home health aide, and you're like, and it's not anything that you want to fire the company over, and of course you could do that, but say it's not the right fit, and it happens. They're going to want to know, it's not the right fit, she's just, for whatever reason, can we try somebody else? Yes, of course, let's make that happen. Your satisfaction is what's important. All of this is for about the same amount of money that you would get from an agency that doesn't have a nurse, believe it or not, and that sends out the owner that just came from working for the highway department and decided to open up a home care agency because they went through a franchise and they figured, oh, what the heck, and it can't be that hard. And
If you're in the
Trust me.
guidelines, who will pay for this if you're in the guidelines of income?
this is private pay.
This is
This is
private
when you're not eligible for any.
But does
Income.
Elder Services also handle if Medicare or other was gonna help with it, the state or Medicare?
That was for the elder services at the beginning of the program,
Right.
not for
So
the
it's
private
two
pay.
different.
Two different, yeah. This is the private pays that you'll see out there, yeah. Okay. Okay, so let's talk about this again. This is very important, which I like to remind people that we're the consumers and that we have a choice. We have a choice with everything. We just it's a healthcare industry. We tend to become very anxious and fearful about certain areas, and we just go by whatever somebody tells us. Here, go with that. Okay, all right, I'm going home with, continue to come to these educational seminars, continue to educate yourself like you're doing now, so when a situation does arrive, you say, okay, I'm going to need to pay out of pocket for some care. Now I know what now I know what to expect, and I know, what questions to ask. Okay?
Joanne, I have a question.
Yes.
It's not private pay, but just popped into my head. The paying Medicare, the services that Medicare pays for, is it Part A, Part B? I have an uncle that only has Part A, Medicare A.
Oh, that's for
And he's just coming
hospitalization.
out this weekend out of the hospital.
Okay, that's for hospitalization. He doesn't have part, it's part, oh gosh, okay. It's
So
part
it's
B
not
or
A.
C.
Okay.
No, it's not.
Okay.
He doesn't have that coverage to go for in-home care? No, not at all. Okay.
Okay.
It may still be part of, that's a good question. I'm going to ask the VNA that I work with. I happen to work with actually the handouts that you picked up, which explains a lot of the services. I work very closely with the Middlesex East VNA of Middlesex East, which is a great VNA, and I'll call. I'm thinking that they have to have that part. It's either B or C. So.
Are we Middlesex East? What are we?
They're expanded. Well, Middlesex East has been in business. The VNA Middlesex East has been in business for I think like 70 years in the Wakefield area, but now they're on the North Shore in the Merrimack Valley.
Oh,
They have great programs. Yeah, they have great programs. That's the handout that I put on the table, and it also gives you an idea, just kind of different programs that if you call another VNA or if you look into another VNA, you can use that as an example of maybe questions to ask. So again, understand your options, research, inquire, ask for references, talk to your friends, family, start the conversation. Obviously you came here for a reason. That's the first step. This enables us to maintain control. The handouts over here, don't forget to take them. I do want to point out that this one in particular, which is actually part of my resource guide, which is this, it's the inside, but I'm running out there, I'm printing more. That's why I photocopied the inside, okay? I'm able to come out and do these presentations for free because I have sponsors. I've been in this industry for 25 years, and I only work with exclusively a small number of companies that I know are reputable, because it's my reputation on the line of when I go out, and I've been here, living here, and working here for 25 years. So they are plus they share the philosophy of education with me. So there are some home care companies on here that I work with that would be happy to ask you any questions answer any questions that you have, just over the phone. It's fine. That's what you want from a company, is don't be afraid to just call and ask a question and just say, okay, thank you, and you can hang up. You don't have to feel like I can't call because I don't need right now. You know what I mean? It's continuing with the research, and it's continuing with education.
Do you speak at all on hospice? Do you have
I
any?
do have a hospice. Yes, I'll bring in a hospice expert for that. That's one of my presentations.
Is that a covered?
Palliative care and hospice. It
Is
is, and
hospice
it's supposed to
covered?
be. It's covered in Medicare. I know you're looking. It's a Medicare covered
Yeah,
benefit, but it has this certain eligibility guidelines.
Skilled nursing.
Yes, exactly.
Skilled nursing.
Exactly. It's eligibility. It's certain guidelines that you have to be eligible to receive that to be paid for it.
And what does eligible mean? Income level? Or
No,
your condition?
Level
skills.
of care.
Right, level of care. Yeah.
So if you don't need a nursing,
It's a little bit more than that. It's just more than that. It's different. It's a little bit different. And when I do have a presentation on hospice care, and I will bring in a palliative care hospice nurse that talks about that when I do that. Yeah. That's a little bit outside of my realm as far as details go. I'm very,
because it seems like it's all around us. So either you
A lot
know
of different
somebody in
hospices
hospice or
too.
going in.
I know. So, that concludes today's seminar. Thank you so much for coming. You had great questions. Continue what you're doing, and I hope you learned something today. I do have a survey here. I'd like to know your input of what other topics that you're interested in. I'll talk to Nisha. Obviously, I'm sure she'll have me back, but she's going to want to have me back for something that you're going to want to learn more about, what's important to what's important to you.
Thank you, Joanne.
Thank you. Thank you.
Thank you.
And then I know